Hi, I'm Julie Biles, and I'm going to be talking about how women in the Australian Longitudinal Study on Women's Health were affected by the COVID-19 pandemic in terms of delaying access to healthcare. This study investigated the experiences of delayed healthcare access among Australian women during COVID-19. We were concerned that delayed healthcare access is a potential collateral effect of the pandemic conditions arising from health rationing strategies which were put in place and the social distancing responses. We were also concerned that delay may exacerbate health risks and delay diagnosis and treatment for chronic as well as acute conditions. To do this analysis, we use quantitative and free text data from the Australian Longitudinal Study on Women's Health COVID-19 Survey 4, which was deployed in June 2020 and which focused on healthcare access and delay. The data from that COVID survey were also linked to the longitudinal data from the main surveys for the women who responded to the COVID survey. And then we modelled the demographic health and health behaviour factors associated with delaying access to general practitioners, specialists, and allied health services. This table shows the access to health services and the delay to health services. The green numbers represent the proportions of women who accessed each of the health services since the pandemic up to June 20, and the purple numbers represent the proportions of women who said they delayed a specific health service since the pandemic up to June 20. So we can see that quite a number of women did access general practitioners and specialist doctors and also psychologists and allied healthcare practitioners. And only about a quarter to a third of the women didn't access any healthcare since the pandemic. But we can also see that quite a lot of women delayed access to healthcare. About a quarter of women in the youngest cohort in their mid to late 20s delayed accessing a general practitioner, and quite a few people delayed access to specialists, psychologists, allied health practitioners, and other practitioners. You can also see that the probability that somebody delayed access to any specific healthcare provider decreased as the cohorts increased in age. So this is one of the things that came out very strongly in the model, that one of the strongest effects as to whether women were likely to delay access to a healthcare provider during the pandemic was what birth cohort they were born into. So the younger women were the most likely to delay accessing a GP, an allied healthcare provider, or a specialist. Compared to them, the women in their 40s were 31% less likely to delay accessing a GP, and the women in their late 60s, early 70s were 73% less likely to delay accessing a GP, 41% less likely to delay accessing allied healthcare, and 34% less likely to be accessing specialists. So it seems that the younger the women are, the more likely they were affected by delay in access to healthcare during the pandemic. Interestingly, there were surprisingly few other factors which came out as significant in our models. Those that did come out as statistically significant associated with delay in access to GPs, allied healthcare, and specialists were having better mental health, which the better the mental health, the less likely you were to delay access. Better physical function, the better your physical function, the less likely you were to delay access to a GP or to a specialist. And put the other way, the worse your physical function, the more likely you were to delay access. The higher your BMI, the more likely you were to delay access to a GP, and the more difficulty you had managing on income, the more likely you were to delay access to a GP. But there was an interaction effect between the cohort and the physical functioning effect, with that physical functioning effect attenuating with increasing cohort age. So it became less important for the older cohorts than it was for the youngest cohort. We also were interested to see that there were no significant associations for delaying any service use for self-rated health, area of residence, state of residence, and we thought this could happen with the things that were happening in Victoria versus New South Wales versus Northern Territory or Western Australia, education level, partner status, or smoking behaviour. And for this analysis, we defined service need as either attending or delaying attendance of the service, and we didn't include women who didn't indicate any need for a GP specialist or allied healthcare service in the analysis. Okay, we turn now to the women's comments, with comments being made by 2,727 women on the backs of their surveys. They weren't all about access to healthcare, but because this was a survey specifically about access to healthcare, they did tend to focus on that topic. And 4 key themes were identified in those comments. One is about the challenges negotiating care during the pandemic. The second one was about ongoing uncertainty towards accessing healthcare when a specialist delays an appointment. The third was about accessing healthcare or not using telehealth. And the fourth was about managing complex care needs when you were delaying or having difficulty accessing care. So just give some few brief examples of the things the women said. These are the examples of some of the things they said about challenges about negotiating care. So I delayed accessing the GP. So this was giving consideration to the GP. He's busy, doesn't need the extra hassle of being pestered by me. I'll just stay out of the picture. Someone else wanted to see the GP to get a mental health plan and for a pap smear and to change their birthday control, but they didn't want to go during the outbreak. Another was putting off annual skin check, leaving, again, being magnanimous and leaving the waiting room free for people who had a greater need. And saying that many of their friends were doing the same. They didn't think that these checkups should be delayed, but felt that they really should sacrifice their needs for someone who had a greater need. One person had a mass lesion, was delaying having that investigated, but was now booked in to see the specialist. And another one didn't realise you could actually have telephone appointments and didn't know that that was existing and that you could have that as an option. So now we turn to what women said about ongoing uncertainty towards accessing healthcare when a specialist delays or cancels an appointment. One person said, my specialist appointment with the gynecology clinic was cancelled and it's not been rescheduled. They'd waited a year for the appointment and no idea when they'd get another one. Another one talked about elective surgery for stage 4 endometriosis delayed, not sure when it will be now, and they're experiencing increasing symptoms and not feeling that they were getting good understanding or support. The third theme was about accessing healthcare or not using telehealth. So one person said that while the phone contact with the GP was helpful, she didn't really participate in the full discussion that she might have. There are things that didn't come up like they would when you're doing face-to-face. And of course, once soon as she put the phone down, she realised what she wanted to say. And she wondered whether or not that actually doctors are good at reading people's faces and helping to get information from them through that interpersonal interaction. Another one had been accessing psychologist appointments through Zooms, but really found them frustrating and more of a hassle than their work. Another one was going to see a new counsellor, but didn't want to initiate that relationship over the phone. And I love this fourth one. The surgeon seems happy because that's the whole point of a clinical consultation, is for the practitioner to be happy. But the person didn't feel completely confident about the results and where they were in their recovery because the surgeon hadn't been able to see their feet and do a physical examination when they were over the phone. The final set of comments were really around difficulties in managing care needs, not being able to organise disability workers and difficulties getting assistance and what that was meaning for them and for their families, feeling that they weren't able to get the support they needed and the impact that had on their anxiety and their daily living. Someone had a craniotomy and was due to have a scan, but because their own health condition was compromised, they felt unsafe and their family felt that they were unsafe going to appointments and travelling. Another young mum talked about midwife appointments being cancelled, mothers group cancelled, being left isolated without support, no face-to-face appointments for postnatal follow-up, and finding it really very difficult as a first-time mum. So this is just a few brief examples of the large number of comments that we received about women's experiences of healthcare during the pandemic. And what's evident is that COVID-19 has had a significant effect on access to healthcare. The women have delayed seeking help care for a whole range of things, from cancer screening, mental health, and conditions with chronic and complex needs. They prioritised or neglected routine medical care, and they struggled to access acute care and cancer screening. Access was most difficult for younger women and for women experiencing disability and financial hardship. And many women appeared disempowered and lacking in awareness or knowledge of what to do in order to be able to get their healthcare scheduled and to have it occur effectively. So thank you for that. I'll be very pleased to take questions, and like to thank the women for answering the surveys every 2 weeks and keeping us informed of how they were experiencing life during the pandemic. Thank you.